Hi, Mrs. Smith. My name is Jolene, and I'm going to be your nurse for today. I actually just received an order from the doctor to insert a catheter. Would it be okay if I did that? Perfect. Just going to perform some hand hygiene first, and I'm going to ask if you could please verify your name and date of birth. Okay, and could you tell me if you have any allergies? Perfect. All right, so I'm just going to raise up your gown a little bit just so that I can prepare the area that I need to work with. Okay. All right, so I'm going to set up all of my materials first. Okay, I have my sterile gloves. Next, I'm going to take up the drape. And by covering my hands, I'm going to place the pad underneath the patient and just drop it. Next, I'm going to take the fenestrated drape and drop it. I have don't need to use this water. I'll adjust it, attach it to catheter. I will open the alcohol pads. All right, so the next thing I'm going to do is clean the perineal area with the alcohol swabs. My catheter has got the tube attached to it for inserting the air. I'm going to lubricate using my non-dominant hand. I'm going to place my hand on the perineum, and I'm going to make sure that I hold the labia open. Starting on the side farthest away from me, from top to bottom, I'm going to wipe the labia. Next, on the side closest to me, top to bottom. And then from the top to the bottom, straight down the middle, I'm going to clean, and that's the last area. Now I'm ready to insert the catheter. So while I'm still holding with my non-dominant hand, I'm going to ask the patient to take some nice deep breaths and then insert the catheter into the urethra. And I'm just going to keep on inserting until I see some urine return. And then as soon as I see some urine return, I'm going to advance it about 2 to 3 more inches. Once the catheter is inserted, I can now release my non-dominant hand to steady the catheter and insert the air. And once that's done, I can release the plunger, and my sterile part is now complete. I will remove the drape. And I can start to clean up. I'm going to attach the bag to the leg with the fastener without kinking the tubing, and I'm going to attach the tubing to the bottom of the rail underneath the bed or at the side of the bed on a part that is not gonna move, so that it doesn't raise or lower as the patient moves or as the bed rail moves. So once that is attached, also making sure that there are no kinks in the tubing so that urine cannot backflow and cause any type of infection. Attach the tubing to the leg. Clean up my area. And the catheter is complete.